Hi everyone, my name is Cindy Ma and welcome to my comprehensive analysis presentation. In this presentation, I will be comparing the healthcare system between China and Japan. Even though the two countries are not too far apart, the healthcare system is different in many ways. We will first take a look at the healthcare system in China. The National Medical Security System in China is a multi-level system with basic medical insurance as the pillar and medical aid as the backup, commercial healthcare insurance, charitable donations, and medical mutual aid activities as supplementary services. The Chinese government has always regarded people's health and life safety as its basic responsibility by providing the BMI as a public good for all Chinese citizens. As of September 2020, more than 1.35 billion people, which is over 95% of China's population, are covered by basic medical insurance, making it the largest healthcare security network in the world. The proportion of healthcare expenditure is about 5.15% of the national GDP, while the total medical insurance financing is about 2.5%. Healthcare spending has risen significantly over the past few decades due to health insurance reform, an aging population, economic development, and an increase in medical technologies. Even though the percentage seems to be low compared to countries with a developed social security system, China is still making a lot of progress to ensure insurance coverage for its citizens, and the overall goal is to establish a universal basic healthcare system. Now we will take a look at the healthcare system in Japan. Beginning in 1961, Japan has a universal healthcare system to ensure that anyone who can receive medical care can have it. Under this system, every citizen participates in publicly regulated health insurance system, such as employees' health insurance, national health insurance, or the latter stage elderly's medical insurance. Life expectancy in Japan has increased steadily over the past few decades as a result of a focus on infectious disease prevention after World War II and the enforcement of universal health insurance in 1961. Japan is now standing as the second highest in the world for life expectancy, with an average of 87.45 years for women and 81.41 for men in 2019. The total health expenditure increased significantly and accounted for more than 10% of the nation's GDP, ranking third among 34 OECD countries. The health spending in Japan is almost doubled as compared to China. Now we will take a look at quality of care. China has increased financial investment and introduced favorable policies for strengthening its primary healthcare system with core responsibilities in preventing and managing chronic diseases such as hypertension and emerging infectious diseases such as the COVID-19 pandemic. In 2020, the total expenditure on healthcare in China exceed over $1 trillion. However, widespread gaps in the quality of primary healthcare still exist, which lead to suboptimal population health and a substantial economic impact. The shortfalls of the primary healthcare system is thought to be caused by insufficient training for the practitioners, the fee-for-service model that costs unnecessary testing and treatments, and the shortage of the integration between clinical care and the public health service, along with other healthcare sectors. A continuity of care is greatly needed throughout the entire healthcare system. And in Japan, 62% of the population were satisfied with the healthcare system. The highest satisfaction was reported for safety of care. However, aging is a severe challenge that the country is facing. The country is defined as a super-age society without a doubt. In 2017, people over the age of 65 accounted for 27.7% of the total population. Thus, it is crucial for the country to remain good quality of care and help the elderly to age in better health. And now we will take a look at the health outcome. In China, the fertility rate is 1.7 live births per woman. Fertility rates declined drastically in the last 50 years from 6.4 births to 1.7 due to the one-child policy, which was enacted in 1980. So under this policy, each couple can only have one child, resulting in a declining new population and a rapidly aging society. In order to slow down the trend of population aging, in 2015, the two-child policy was enacted, which relaxed the birth restrictions. However, the policy did not result in an expected wave of birth, and the pregnancy rate among young women continued to decline, experiencing a third consecutive year of decrease. Starting in 2020, China is now under a three-child policy. The life expectancy for female is 80 years and for male is 75 years. Infant mortality rate is 8.4 deaths per 1,000 live births, and child mortality rate for children under the age of 5 was 9.8 deaths per 1,000 live births. In China, the top 5 causes of death are cancer, cerebrovascular disease, heart disease, respiratory disease, and trauma. The top 5 causes of death in China accounted for more than 85% of all deaths in 2017, in which cardiovascular and cerebrovascular disease accounted for the largest proportion with the steepest increasing trend. And in Japan, fertility rate is 1.36 live births per woman. Starting the 1970s, the country has failed to raise its fertility rate to the replacement level. The Japanese government launched a series of initiatives trying to raise the fertility rate. These programs aim to create parent-friendly working conditions, enhance childcare services and facilities, improve the educational environment for children, and ease the costs associated with child rearing. However, the impact of these measures have been minimal, largely due to limited resources and a lack of alignment between society and government agendas. We already talked about the life expectancy in Japan, which was 87.5 for female and 81.4 for male. And the infant mortality rate is 1.8 deaths per 1,000 live births, and child mortality rate for children under the age of 5 is 3 deaths per 1,000 live births. Japan has the longest average life expectancy, and this is primarily due to remarkably low mortality rates from heart disease and cancer, which also lead to a low prevalence of obesity in Japan. Long life expectancy can be attributed to healthy dietary habits, access to clean water, universal health insurance coverage, a hygiene-conscious culture, and an active lifestyle among the older generation. Since Japan and China are both aging society, so this is a common problem that both countries are dealing with. I will propose 6 suggestions to combat the aging problem. The first one is to encourage fertility, even though there are numerous initiatives that the Japanese and Chinese government are working on to increase the fertility rate. The result is still not prominent. Encouraging fertility will fundamentally increase the labor force and solve the problem of aging from its root. The second one is to delay retirement. A system is needed to encourage people to work regardless of their age to elevate the adverse effects of population aging. prolonging the legal retirement age will help relieve the pressure on social pensions and the healthcare system and will benefit the society system as a whole. Improve the stability of the social security system, which also will help the stability of the nation's economy. The fourth one is to reform the medical and healthcare system to ensure coverage for all and to reduce the out-of-pocket expenses. The fifth one is to create a more caring society for the elderly by promoting long-term care and integration among stakeholders at various levels. And the sixth one is to strengthen primary care training for medical school students. Both countries do not have enough primary care providers. The educational system is designed in a way to train specialists instead of primary care providers. Both governments need to find ways to train more general practitioners as well as to train more healthcare providers. And here is the list of the reference. Thank you so much for watching.